This is Daviess County Judge Executive Al Mattingly. We're doing our weekly update. I'm here with Clay Horton. He's the director of Green River Health District. I thought it'd be pretty interesting to have Clay in here because I've been getting a lot of questions about the vaccine. Before we go there, let me start as I usually do. Our report today is in Daviess County. And where did I put it? I think it's about 70, 71 cases, Clay. I can't remember it exactly.
Yeah, 71 is correct for the
71 cases. Unfortunately, we've had 4 more deaths in Daviess County. So active cases, we passed 6,000 today. We now have 6,069 confirmed cases, I'm sorry. With 103 deaths. So if you would just take a moment, let's just think about those who have lost loved ones, moms, dads, brothers, sisters, who won't be with us this coming year. Thank you. If there's any good news, it looks to me like our number of active cases, if you take the confirmed cases, subtract the recovered cases, subtract the deaths, and you're going to get the number of active cases we have in our county. And it's dropped a little bit. It had been hovering around 1,500. We're down around 1,417 now. And what really pleases me, Clay, and I don't know if I should be pleased because it may be a result of the deaths that we've had, but we've dropped down from, I think last week we were at a high of 32 cases in the hospital. Today we're down to 25 cases in the hospital, and the number of people that we have in the hospital kind of is an indicator of those folks that we may lose in the coming weeks. Jordan, if you can hear me, why don't you bring up a map of the rates of infection of the state? All right, there we go. Can you make it a little larger? There we are. So this is the current COVID-19 incident rate. This is as of yesterday, doesn't include the cases today. You'll notice that Daviess County has an incident rate of 72.3 cases per 100,000. Good thing about Daviess County, it's pretty simple to figure, isn't it, Clay? We've got very close to 100,000 people here, so the number of cases are the number of cases. If you go up and look at Hancock County to the right on this map, Hancock County has an incident rate of 113 per 100,000 cases. That doesn't mean that they've got 113 infections. What that means is Hancock County's population is about 1/11 of Daviess County. So whatever their rate is has to be multiplied, or whatever their number of cases average over 7 days has to be multiplied by 11. So with such a small population, that can change very rapidly with just a few number of cases. Down along the bottom of the Tennessee border, look at Cumberland, Clinton, look over at Horton. Those folks have over 100 cases. There is one in I can't remember, it's in the 4 East, and our pictures are blocking at K. Well, let's look at Boyle. You see Casey County, that's in the orange, just above Casey County is Boyle, 149.7 cases per 100. The best I remember, Clay, Daviess County, the highest we ever got was about 95 cases per 100,000 back early in December. And we've been hovering around that 72 case. So you can take that down. Get her down there, Jordan. Thank you. All right. So that's a little update on Daviess County and the incident map. One of the things that Clay and I were talking about, we're going to be taking questions from you folks today. We have some that have already been submitted, but a lot of the questions, Clay, if people would go online and go to Kentucky, COVID-19.kentucky.gov and scroll around, that's the state webpage or state webpage. You can find an answer to almost every question that has been pre-submitted to us. And that's a lot of great information. We keep things on our Facebook page every day. I know that the Green River District Health Department keeps things on their webpage. As a matter of fact, I know, Clay, you keep a schedule of COVID testing. You keep a schedule of flu shots, flu vaccines that are available. And let me assure you, before we get into this, I'm going to speak for Clay and for myself. The minute we know anything about when someone might be able to get a vaccine, we're going to place it right on our Facebook. As a matter of fact, on our Facebook page today, we place the updated version of the vaccine. It's the vaccine update by the state, which talks about 1A, 1B, and all those who are available. And we're going to get into that here in just a second. Clay, I've talked too much. Everybody wants me to shut up. Let's listen to the expert. Welcome.
Thank you, Judge. I'm always glad to come on and with these discussions, and thanks for the opportunity to share a little bit of information about what's going on with COVID vaccine. That's a lot of inquiries about it, a lot of people interested, and we're pretty excited that we're in the phase where that's rolling out. I'm more excited about getting past some of the first few bumps in the road and getting this to where it smooths out. And we're very optimistic about 2021 and what that's going to look like.
Okay. You know, there's been a lot of talk, and let's just talk generally before I get into the questions. There's been a lot of talk from people who want to know, what are the schedules? When can I get my vaccine? Who will tell me when it's time for me to get my vaccine? Will I be notified by the health department? Will I have to go to my doctor? Who will be doing this? Right now, you don't know, and I don't know, other than a general rule that has been put out by the state. And I want folks to understand this isn't being driven by our local health department. This isn't being driven by your local government, city and county. These are the guidelines that are being sent down to us from the state and specifically from the State Department of Health, Kentucky Department of Health. And they're based on federal guidelines. They're based on CDC guidelines, but each state will tweak them a little bit. So I don't want anybody calling me and saying, well, my friend in Florida, or they've opened this up in Indiana, because there are different states or different areas. We're following along with what we're being told and guided to do. Anything to add to that, Clay?
No, I think that's correct. And you know, when I said happy to get the bumps out of the road, I think that you don't have to look too far, national news, state news, to see that there've been bumps in the roads, lots of different places. And despite whatever those interpretations are of the federal guidelines, there are manifestations of things going wrong, whatever mode that takes place in. I have every faith, though, that once we get into a cadence and a rhythm, that this will operate the way that it should. And you know, there have been some pretty encouraging signs here in Daviess County. You know, the health department here got a very small amount of vaccine first. And we administered that to people healthcare workers, non-hospital based healthcare workers that work in that 1A category. And kind of as a proof of concept, you know, we did our vaccination clinics and they ran very smoothly. Owensboro Health has a very similar experience. You know, they received vaccine first that was dedicated for their patient contact workforce. You know, in the weeks since that we ran out of vaccine in Daviess County, they've been very good partners in helping us with these other 1A workers that we had lined up and had registered, but no vaccine for. And they've taken on that challenge and taken, you know, their role in the community to assist with that. So now we're all talking and looking forward to next week when you know, with some of the new processes that are being pushed down from the state and some are being built and allowed us to tap into, so that, you know, all of our organizations can kind of be going full bore as vaccines available, and we're working through those priority groups that you talked about having posted on your webpage.
You know, Clay, this reminds me a whole lot of kind of dancing a waltz. I mean, there are a lot of moving parts, but a lot of times it doesn't look very smooth, but it's smoother than it looks. And there are just a lot of things. I know you and I talked about it. Let's trade vaccine. If one place has too much, and that's happening, one place is getting more than they need delivered, let's just transfer it to the Daviess County Health Department. Doesn't happen that way, does it?
It doesn't. And also, you know, I think that even at a state level and a national level, there's been some lessons learned over the last 2 or 3 weeks. And, you know, so we're still committed to trying to follow these priority groups, because those are based in bioethics. There's been a lot of input and insight into that. And we think that there's solid reasoning behind it. But at the same time, and they announced this at the Kentucky Department for Public Health Monday night. At the same time, there's a sense of urgency to get the vaccine out and get it administered. So, you know, we're going to have to kind of balance a couple of different goals. And one of the goals that we added this week and that we're committed to doing is that all vaccine that's received is administered very quickly. Obviously focusing on those priority groups. But, you know, the stated goal is 90% of everything you receive should be administered within 7 days. And again, we're continuing to ramp up our systems and to make sure that we're able to do that. Last night, the state switched from a model where they were just what they called pushing vaccine. You know, they just would distribute it out to people unrequested. But now, you know, now they're asking us to submit an order on you know, every Wednesday. It looks like is what the cadence is going to be. And there's some conditions with that order. And one of those is that you have to not request any more than you can administer next week. And so we're starting that process, and we think that's going to work well.
Okay. Whole lot of questions, but before we go, Jordan, can you bring up the vaccine update, the various phases, so we can go through those for folks? And maybe as I go down them, Clay, I'll ask you to kind of comment.
Sure.
That's the one. This is the vaccine update. Clay, I think this is the latest guidance from the state that I've seen. I believe this came out on the 4th. Was that Friday, Saturday, Sunday? That's probably from the meeting that you had. So as you look, the first phase is long-term care facilities, assisted living facilities, healthcare personnel. And it makes sense. I mean, 66% of the deaths that are being reported in the state of Kentucky occur at long-term facilities and in assisted living facilities. And we've got to get our healthcare personnel vaccinated and protected. And I would assume also this is including those people who work in those facilities, Clay, because if you don't, and those people, we start losing healthcare personnel, we start losing the people who attend to our long-term care facilities folks, then you don't have the people necessary to take care of them. And what would happen in those facilities is the same thing that happened to some of our schools. We didn't have COVID running rampant through the school system. By that, I mean the kids. It was taking out the auxiliary personnel, the lunchroom workers, the janitors, the people that had to be there for it to function. So that pretty much makes sense. And that's what's being done right now. Correct, Clay?
That is correct. So the long-term care and assisted living facilities are being handled by pharmacies that have been contracted directly from the federal government through a program that they opted into. All of our local facilities are opted into that program. They are working with those facilities directly. They'll be on site 3 times to make the rounds to administer, you know, both doses of the vaccine. Those visits are happening. They're rolling. They're vaccinating the residents. They're also vaccinating the employees. And the stated goal is to have every long-term care facility, assisted living facility in the state fully vaccinated by March 1st.
Clay, just while we're there, I had a call from a lady at Park Regency, and she was wondering about that facility. And you know, it would seem like it's a long-term care or assisted living, but I think you define that otherwise, and it probably will fall into the 1B category. What was that definition?
I think it was an independent living facility.
That's correct. Yeah.
And I think that, you know, we have some information on that facility and others, and we are looking at how we can assist and hit populations like that. Probably most will be in 1B. There possibly could be some that are 1C. But at any rate, we do know that it's an older population. It's an at-risk population, and as vaccine becomes available, those will be some of the priority groups that we're working through.
I also had a question early on, and I reminded them they needed to watch this show. It had from some of the funeral home directors, folks who interacted directly with families of deceased personnel, and wondered where they would fall.
So I think it depends on the job that they do for the funeral home. But for morticians, anyone that's preparing bodies possibly comes into contact with bodily fluids, just like a healthcare worker would. They're categorized in that 1A category. I know just from looking at some of the groups that we've been working with, I've seen funeral home directors and morticians and coroners enrolling in our program. We are working with those groups to get them vaccinated.
Okay, I'm trying not to jump around, but this just popped in my mind, and if I don't ask it, I'll forget it. Funerals, weddings, large gatherings, still the super spreaders?
They can be, yes. So the healthy at work guidelines that we've all been talking about for months, those are still in place. So it's very important that those events be held safely. So they should be small. People should social distance. People should wear masks when they're around other individuals, and all of the things that we've been asking folks to do. Even though vaccine is on the way and vaccine is here, we're going to have to continue to do those things until we reach a point where we have enough protection from our own immunities in our population.
Okay. 1B, first responders, anyone older than 70 or older, and K through 12 school personnel. Comment a little bit about that. What's going on there?
So first responders, think about fire, police, EMS, which are our paramedics and EMTs. Those would fall into 1A. And 1B, even some of the facilities like the jails and prisons will be included in 1B for their employees. School personnel, is a lot of planning is taking place right now in order to get vaccine to school personnel that want it. The school systems have submitted rosters of their employees to the state of people that are requesting vaccine. Those, depending on the school system, will be administered by various different partners, probably Walmart, Kroger, or a local health department, depending on the community and what's available. What we've been told is kind of the target date for that is around the 1st of February, plus or minus a week probably. I've got a meeting here at 12:30 this afternoon, and I know that that's a major agenda item is how we're going to do that rollout. And I've talked to all of our superintendents in the district, and I think everybody's excited about that opportunity and excited to get that population vaccinated.
I've had a lot of conversation over the past week, 10 days, from people who said, well, that's fine, but how will I know when it's time, and where will I sign up? And my answer was, nobody knows yet. We're still working on those details, but believe me, the minute that we have correct information, it'll be on your Facebook page, your web page, it'll be on ours, it'll be on the state's. We'll do everything that we can to get the word out.
Yeah, and that's a good point. And I think we'll do that as we work through these phases. So like right now, if you're a 1A person, if you work for a healthcare facility, you work in healthcare, you can sign up for that through our website. Now, what we ask is that, you do those in groups of like the offices. So, point of contact with your practice or your organization, reach out and start that process with us. We ask some very simple questions like the type of work that you do and how many employees that want to get vaccinated. As we are told, we're ready to go on 1B and C in phase 2. We will probably have similar systems in place. I know One concern that we've had is, we may have demographics that are not so computer savvy.
Right.
So we're going to be looking for multiple avenues. The internet way to sign up is very efficient, but if that's not going to work for the people that need the vaccine, then we'll look for alternate ways as well.
Right. Clay, one of the things I would say, and I think I'm right about this, so 1A goes along and there's somebody in that 1A group, and now we start vaccinating 1B. The 1A is in the group. It's not lose your turn, you're gone. 1A and 1B then would be taken care of. Just as when we go to 1C, anyone 60 or older, anyone older than 16 with CDC high risk, and all essential workers. So once you get down to 1C, 1A and 1B can still get vaccinated. They just need to go through the procedure of signing up or finding from either the provider, and they're always welcome to call the health department. They're always welcome to call here. We try to stay update the best we can. But so now we're down to 1C, older than 60, anyone older than 16 with a CDC high risk C19 condition, and all essential workers.
Yeah, that's correct. So CDC broke down essential workers and frontline essential workers and then other essential workers. Kentucky's really kind of lumped those together in 1C. And I don't know, this slide deck that Jordan pulled up, I don't know if he has the full slide deck, but they do kind of go in and break down some what the categories of essential workers are. So.
Right. I will get there somewhere. Move back, Jordan. I'm not smart enough to remember. So the number 2, anyone 40 or older. Number 3, anyone 16 or older. And number 4, children under the age of 16 if the vaccine is approved. And what I think it's Pfizer has been approved for anyone 16 and older, Moderna for anyone 18 or older. It has not been approved yet for use in children under those ages. Is that correct?
That is correct. Although we expect as clinical trials are done that may change. Right. But currently, the 2 vaccines that we have approved in the United States are the Pfizer and the Moderna, and neither of those are indicated for children right now.
Jordan, while you go to the definition of essential workers, if you don't mind, get over there. It just kind of popped into my mind, Clay. If I were an employer, particularly if I had essential workers, here at Fiscal Court, we have done this. I would circulate a questionnaire of how many of my employees would want the vaccine, so that I would have a ready list of those folks, perhaps their phone numbers where they could be contacted easily, so that when their turn comes up, that there's no hesitation and you can get to them right away.
Yes, and I mean, I think we've recommended several or the similar things with the groups that we're vaccinating now. I'll tell you that I've had conversations with several employers this week that fall into these categories, and I've made that suggestion. I made it more of be ready to do that because you want to see. I don't know if you want to do it too far in advance because that data may change. Right. But that's thinking about that process and thinking about how you would do that. Is very important for anybody that falls into those categories right now.
All right, so that's about all the info I've got there. Jordan, that very last slide, and this can be found as well on the state's website. I mean, the state, Clay, the more I get in there, the more impressed I am with the wealth of information that's there. Not the goal. We know the goal is to administer 90%, but the next one. Remember the one, Jordan, that talked about what's a vaccine, can mRNA, do you remember the one I'm talking about?
I think that's the frequently asked questions that's on that website.
There you go. So this is the one that I found very interesting, and if folks will go there, again, it's Kentucky COVID-19.kentucky.gov. There are a list of frequently asked questions, and pretty much you can find the answer to every question that I'm going to pose to Clay. There's a huge list. And again, if you don't don't find the answer to your question, submit it to us on our Facebook page and we'll get it to Clay and we'll try to get you an answer. All right, Jordan, get off of there. And first question, and we've answered it, but are there signups for people in Group 1B?
Not yet, but stay tuned. It will happen. Other than school personnel have signed up through their employers.
Right.
And the final arrangements on that are pending. We should see some movement in the coming weeks on that.
But if you're in the general population and you're 70 or older, there is no sign up available yet.
Right. Not for the 70 and older. You know, we've also done some discussions with our first responder groups.
Right.
So there has been a process there, a planning process. But for those that fall into the 1B because of they're over the age of 70, that sign up process is to be determined.
Clay, I had a call earlier this morning, and I want to thank this person for calling. They are a retired medical worker, I think a retired nurse, and they're willing to volunteer to help with this issue. Could you tell us how that might occur, or could that occur? Can it occur?
Yeah, it could occur. We have a program here at the health department called the Medical Reserve Corps, MRC for short. It's not a new program. It was something that was put into place probably in the early 2000s after 9/11. And the idea is that to provide some surge capacity for public health workforce, and retired medical personnel are a perfect fit for that. So we already have a mechanism in place. We have information on that on our website. I would say that we are probably, the rollout is not operating smoothly enough to bring in probably volunteers to do that. But I'm hoping that we're not far off from where that can be of great assistance for us.
Okay. A second question that we received just now was, I think we answered, are there signups for people 70 and above that live on their own? The answer is no, not yet, but just stay tuned, read all that you can on websites. And as you say, there are a lot of folks like me that's not very computer savvy and wouldn't, normally I either get lost or my computer locks up when I'm looking around. By the way, the picture, the quality of sound and everything is so much better today.
Oh, good. Don't jinx it.
I'll give props to Jordan Rowe for fixing whatever that problem was. It says, are you sharing vaccination information with physicians' offices? I would assume that info was put on my chart or whatever it is, the electronic record that's kept for people,
whether someone has had a immunization or not.
Yes.
So there is a Kentucky immunization registry. It's a web-based platform. I don't know if every physician has access to it. They could if they would like. And one of the requirements that the CDC has put on all vaccine providers is that information has to be entered in the immunization registry within 24 hours of administering the vaccine. And that's an intensive process. There's a lot of behind the scenes work that goes into administering these vaccines. And I can just, say that our staff is working very hard to figure that out and how to streamline that. A lot of times we do a lot of the work on the front end so that when you show up to get your shot, it seems like it runs pretty smooth, but there's a lot of work getting it ready for that moment.
And that's why if you make an appointment, show up for the doggone appointment, folks, lest when you finally get there, they'll stick a needle this long into your arm.
No, they're much shorter than that. And that is a good point too. And there are logistical challenges with both the Moderna and the Pfizer vaccine. They're pretty delicate medicines. And one of the things is, they come in multi-dose vials. And so what we've had so far is all Moderna. Those come in 10-dose vials. And once we draw that first dose out of any particular vial, the clock starts ticking. And so we try to plan and have appointments scheduled for the exact number of doses that we're going to administer that day. And if you don't show, we've got a precious commodity that's going to go bad. So we start scrambling around. We have standby lists, those type of things. But yes, if you have the opportunity to get an appointment, by all means, do everything possible to make sure that you get there and get there on time.
You bring up a good point, folks. You're going to hear some people who go outside of these lines of vaccination. It's not normal, but a lot of times I heard of up in the eastern part of the state where somebody had thought out a bunch of vaccine. It was going to go to a nursing home. They weren't prepared. They weren't ready. and they call folks in, and people who were not in assisted living, not in nursing homes, not medical personnel, but they use that vaccine, and my hat's off to them for thinking quickly and not wasting it. I know this past Saturday, I got a call from our fire chief. He'd gotten a call that the same thing had happened. There was some vaccine available. He asked if I had any problem with it. I said, absolutely not. Now, these were paramedics, actually medical personnel and paramedics. I said, Chief, if you got the guys that want to get it done, get it done. All right. So when will the vaccine be available to the general public, and what is the notification process? I think we talked about that.
Yeah, it'll come through mass media. And, the other thing is right now we've got, hospitals, and in our community hospital has vaccine. We had vaccine, we've administered it. With some of the federally qualified health clinics are getting vaccine. But there is this distribution network being built. So, we think we'll see other chain pharmacies, independent pharmacies. There are medical entities that normally administer vaccine that are going through the process to be providers. So as vaccine becomes readily available, more available, what we hope is that there's going to be multiple avenues within the community for people to receive vaccine.
I was online going through the application process to become a vaccine provider. I'm glad that I don't have to do that.
It was long. Intensive. I don't know that it was that difficult, but it was long.
It's pretty intensive. Yeah. Who's eligible to receive the vaccine right now? We've talked about that already. Long-term assisted living medical providers. Can you address, and this is one that's out there, and you're going to hear, and I'm just telling you, you're going to hear things like this. Take them with a grain of salt, but can you address why some people are receiving a vaccine, even if they don't work directly with COVID patients? Why not the elderly or people that are at a much higher risk? And I'll answer the back part. The elderly are going to get it here pretty soon. Those people at higher risk either are getting it in nursing homes or assisted care. But speak to that. How would that happen? How would somebody jump the line?
Well, I don't know about the specific circumstance, but what I will say about the 1A category, and I'm sure this memo or this letter is available at covid19.ky.gov. But the state has provided a pretty thorough interpretation of that, and so for healthcare personnel, that includes all roles and responsibilities within the type of business or organization that's providing clinical care to anyone. So, the person that checks you in at the front desk has contact with patients. The person that comes in and the environmental crews that come in and clean the room between patients have contact with body fluids. The person who transports lab samples to from the office to the lab have the potential to come in contact with infectious materials. So that 1A category, those healthcare worker categories, they don't just extend to the doctors and the nurses. It's everybody that makes the operation run.
Well, I would, just as an example, and I don't know where this one came from, but Owensboro Health, huge, more than 4,000 employees total. The health park falls under Owensboro Health, as do some other clinics. Somebody that's at the desk checking people into the health park, not only to exercise, but to receive physical therapy and other things, tests, probably would have gotten vaccinated under Owensboro Health's scenario.
Yeah, I know that they've worked very hard and they have a very thorough plan in terms of even within their workforce who had priority, and I'm sure that's being addressed.
Okay. All right. We've addressed this, you and I both, on lots of programs, but how does this virus compare with the flu in reference to death rate, hospitalization, and health effects?
They're orders of magnitude different, and I think this is something that we've heard.
Meaning, let's just talk orders of magnitude. So 10 to the first fire, 10 to the second fire, 10 exponentially different, right?
Probably. Death rate's probably somewhere around 10 times higher for COVID-19 than flu. A lot of this is still being developed. COVID-19, we've had experience with it for 10 months. But a bad flu year in the United States, we measure deaths in tens of thousands. A really bad flu year would be maybe 60,000 deaths for the entire country. I didn't look at today's number, but we're above 350,000 for the United States at this point. They are not comparable in terms of severity. I don't want to downplay the risk of flu. I mean, I've been in public health for 22 years, and trying to get people to take flu vaccine and precautions every year has been a big part of what we've done, and that's still going to be important. But what we're facing with COVID-19 is much more serious, and it's I think it sometimes distracts and hurts our efforts, frustrates our efforts when we see these types of comparisons.
It just came to mind, the flu and COVID-19. There are a lot of people who have the flu and they have mild symptoms. Same thing happens in COVID. There are a lot of people who get COVID and they have mild symptoms. There are some people who end up in the hospital because of flu, and usually they are the ones who are compromised by some kind of health condition. But a lot more people end up in the hospital from COVID-19. It just is. I had somebody on Facebook the other day. I was on there surfing the wave, and somebody said, "Can you name anyone who's had COVID-19, and do you know anybody who's died from it?" And the answer that was being given back in April, May was very few people could answer that yes in the affirmative. Almost every person that was on there said yes, and I know someone personally who has passed away from it. It's just a terrible disease, and as you said, it's much more transmissible apparently than the flu, particularly with the new strain of the flu. My understanding is we probably had that here in the United States for quite some time, but we don't have the ability like they do in England to distinguish between the two different types. So anyway, have they studied how the vaccine affects pregnant women or nursing mothers?
There's not a lot of data on that. There's not being recommended against that, but we would say if you're pregnant or nursing, that you would want to check with your own physician before making that decision and weigh those options.
And I would suggest you go to that very document we talked about. That's one of the questions that's answered there. Where can I find information about COVID-19 vaccine in Owensboro? Is there a website? Who do I call? Well, again, we've talked about it. You can go to Kentucky COVID-19.ky.gov. You go to your webpage. You can go to our Facebook page. The various places that we've talked about this morning have a lot of information about it. If you're looking specifically for information about the COVID-19 vaccine, how it's made, what's in there. Dr. Dufresne and I talked about messenger RNA last week and how some people said, hey, it gets in your body and changes your DNA. No, it doesn't. It gets into the cell cytoplasm. That's the stuff outside the nucleus, and inside the nucleus is where the thing that makes you, the DNA, resides. Never gets in there. So all that information, though, can be found on Facebook with a little bit of research. Do I need to wear a mask after I get the vaccine? If so, when can I stop wearing the mask? And I'm going to let you answer it, but I know the answer.
In the short term, yes, you're going to still have to wear a mask, and there's going to be a period of time where not everybody's had the opportunity to get vaccinated yet, even though everybody's working as hard as they can to make that happen as quickly as they can. But the vaccine is one of our tools for slowing the spread of COVID-19. It's probably the most powerful tool that we're going to have. But that doesn't mean that the other tools that we've been using these last 10 months are going to be any less important in the short term. So yes, if you're interacting with people outside of your household, wearing a mask is still going to be very important for a while. Continuing to social distance and wash your hands frequently is going to be important for a while. We all just want to continue to be safe, but there will be a day where we won't be as restrictive on that. We won't have these inconveniences that we have now. But in the short term, yes.
Okay.
the day after you get vaccinated. And also the other thing is there's a period of weeks
There you
for your
go.
body to
Okay.
build up
Yeah.
the immunity that you're going to need. So, there's right now what we have available is a 2-dose vaccine. They're saying that probably a couple of weeks after the second dose is when you're going to have peak immunity.
Okay. Yeah, I was going to bring that up because you're going to hear people that say, as a matter of fact, if I'm not mistaken, Auditor Harmon received his vaccine one day and tested positive the next day or 2 days later. So I mean, when you get that shot, that doesn't mean you're home free. You can't stop being careful. You can't stop doing the things that we have been told helps control this virus, and it does take a while to build up the immunity. That's what happens when people who say, I got vaccinated for the flu and I got the flu. Well, you probably had the flu before you got your shot, to be quite honest. So who's paying for the vaccine?
Federal government's paying for the actual vaccine. So you and me and all of our federal tax dollars are paying for that. Now, we are required to bill insurance for an administration fee for giving the shot. But there's no out-of-pocket cost to any individual, or when we work with employers, there's no out-of-pocket cost from the employers. But we will bill insurance. I think the standard rate's about $18 a shot is what the goes to the insurance. And, so we are required to get some of that information, but again, the ability to pay is not going to prevent anyone from getting a vaccine too.
Thank you. I started to say that if you don't have the funds, if you don't have insurance, if you don't have any ability at all, you fall in those categories, you sign up and you're going to get vaccinated.
That's correct. So, and there's avenues for us to report that as well. But yeah, there's again, a lot of behind the scenes work that goes into this, but no, ability to pay should not come into any individual's mind about whether that's weighing on their decision to get vaccinated or not.
Just a couple more, Clay. I know you've got another one. This is one that I wrote down because I heard of this happening. Can I go outside of Daviess County and get vaccinated if somebody else has a lot of the vaccine?
Probably. If that's one of the challenges that we're seeing across the country and even in the state. We've been given these general priority groups, but then there's a lot of nuanced decision making that happens on the ground. Everybody should be playing by the same rules. In May, I've had instances where I've been told that a healthcare facility a few counties over was opening it up to anyone that wanted it. And then when I actually saw what they were doing, they didn't. They were doing some of these standby lists for open vials and that type of thing. So, I think all of this is going to be evolving. As we talked about, Monday night, the state tweaked their strategy a little bit in terms of, adding that goal of getting everything administered within 7 days. And that's going to play into it. You're going to have these dynamics. It's not always going to fit in these perfect little buckets. But in general, the phases that we've laid out, that's the game plan. And hopefully we can all kind of row in that same direction.
Clay, in the end, and I know I can speak for you here, you and I want anyone and everyone who wants that vaccine to have access to the vaccine as soon as possible. The unfortunate fact is there's not enough vaccine to go around, and we're still building the system to get it out. But you guys and everyone else are doing everything they can. I've got one more question, but I just remembered I want to thank you and your staff and everyone that you work with for the tremendous job that you guys are doing. I'm not sure, and every time you've come on this show, you've had a smile on your face, and sometimes I have a smile on my face, but usually it's a pained look because somebody just chewed on the other end. But you guys have really gone above and beyond, so thank you. Last question, and last two questions. How long does the vaccine last?
Your immunity from the vaccine? We don't know yet. We're hopeful that it'll provide long-term immunity. They've just finished the clinical trials to prove that it's effective and safe. There's going to be more data that needs to be collected to see where this goes. You've used the analogy, we're building the airplane as we fly. It was very important to get this out as quickly as possible. That's why they did it. It's to be determined whether this will be something that you have to be revaccinated for, like you do with flu,
Right.
or if this is going to be a one-shot deal. So we'll hope for the best, but we'll do what it takes. When we learn the answers to that question.
Sometimes vaccines, like for smallpox, polio, have long-term effect. The flu, though, I mean, that's why I get vaccinated every year, hoping that we choose the right strain. But this virus apparently is just like the flu virus, and it mutates, and that can change exactly. But we believe, and that's one thing I'll bring up, there is a new strain that's running around, a little more easily transmissible. But from all indications, the vaccine that we're using for the first virus is just as effective against this virus.
That is correct.
Last one. When will Daviess County get out of the red zone? Have we seen the spike from Christmas? Let me answer the red zone question. Your guess is as good as mine. I mean, I hope it's sooner than later. But I really don't know. There for the longest time in December, every county in the Commonwealth was in the red zone. Today we've got a few in the orange and one in the yellow, I think. But quite honestly, those counties are very small counties population wise, and just a few cases will make huge swings left and right. It looks to me like, as I showed you guys, the counties that are on the borders with other states, Indiana and Tennessee in particular. Tennessee is a burning with fever right now. That seems to be where there are huge spikes, and so I really don't know. I wish I could tell you we'll be out of the red zone next week. Realistically, I don't think so. And that brings up the last one. Clay, when do you think we'll see a spike from Christmas gatherings and New Year's gatherings?
Yeah, it's a little early to say, but I think we're seeing it now in terms of some of the numbers that we've been reporting out. The state reported a kind of a low number yesterday. I'm not sure if we're an anomaly or if there may be some data lag problems with the state's report yesterday. I know my staff was complaining about the electronic data system that we provide that data to kept crashing Monday. So I suspect that slowed a lot of people in the state down. We peaked in our district around December 5th. And then we saw a nice decline. Daviess County was a little bit behind that, I think December 11th. But we were making some really good progress, and I was pretty encouraged. But the first part of this week's been busy. I think Christmas is playing a dynamic in that. I think that the declines that we were seeing through the latter part of December, though, were a result of some of these big sacrifices we made as a community. We asked schools to go virtual only. We asked restaurants and bars to cease in-person dining and service. I know that hit people hard. It hit people hard at a bad time of year for that. But it really did make an impact. You mentioned Tennessee. Indiana is a very similar story. If you look at these incident rate maps in other states, right now Kentucky looks like we're in the eye of the hurricane. I mean, we're red, and we're red. We don't differentiate between shades of red in Kentucky, so there's a lot of red. But these other states have much higher rates than we are, and again, I think that goes to the sacrifices that we all made as a community.
What's that hottest color? The other states are magenta. I mean,
I don't know. It
is amazing.
I didn't have a chance to prepare on my colors, but yeah.
I talked to a friend down in Florida, and he said in Florida everything is opened up and the virus is running rampant. My phone's ringing, Clay. We're done. Thank you for everything that you're doing for our community, and look forward to talking to you again.
Thank you, Judge. I always like to chat. Thank you.
Okay. See ya. Bye-bye.